report is to go into closed session. Do I hear someone with a motion that we go into closed session?
Chairman Pennell, I move that we go into closed session to discuss confidential personnel matters as are listed on our current agenda.
Is there a second?
Second.
All those in favor say aye. Aye. Any opposed? And motion passes, and we will be going into closed session, and we'll be back just as quickly as we possibly can. Superintendent, Dr. Don Phipps.
I'd like to ask Helena to come up if she would, and there's just updated information on the pre-K side that we've not talked a lot about, and I wanted to just have her kind of briefly go over some information. Kathy will hand that out so you can have that.
Chairman Pennell, Vice Chair Branch, members of the board, and Dr. Phipps. Preschool received information from the NC Pre-K program on August 3rd, which was Monday, and it allows for parents' choice, which we have not gotten to this point, for full classroom, hybrid, and remote classrooms. So we did poll parents at the end of July, and about 69% said that they preferred a full classroom, while 15% were hybrid, 15% were interested only in remote. So we do hope to offer that to families who are interested. And there are, of course, additional regulations that we've been assigned to do that. Any questions?
Just wanted you all to have the update because changes are going on in all of our programs, and Vicki wanted to make sure that you were aware of it before they put anything out.
We're hoping to have pre-K sites at the site, all the elementary schools that we had sites at last year.
Right now, yes.
Good.
How many sites is that? We have 12 sites in the school system. And in community sites this year, there will be 3. We typically have 4. 3 in the community. Mm-hmm. Thank you.
Thank you.
There are a couple of parts of what I want to share with you. And the first one is something I want to pass out today and ask us to take it up on Monday night. So I'm certainly not asking for any action on this, but out of a lot of the work that we're doing, one of the areas of concern for us has been transportation from the get-go. Transportation in terms of length of bus routes, number of students that we can put on buses. At the very basic level, do you have bus drivers to drive buses? And Kevin and I talked last year about taking a look at what state recommended pay is for bus drivers, and wanted to share that with you just so you have a chance to look over what that adjustment would be. We feel like this is going to be critical for us, particularly at a time when we're going out to reach out to individuals that may not be drivers right now, to encourage them to consider it. This is certainly not going to make anybody rich. And if you take a look at that, it's kind of embarrassing that we've got salaries that are at that level, but the responsibility that we put in the hands of a bus driver, and many of them right now are employees of ours that are serving other roles, but we do have some folks that are not otherwise employed with us, and we just want you to consider this. And I want to bring it back up on Monday night, and as we go out and we try to fill vacant spots that we can't fill in other ways, that we feel like this would make it more attractive. Maybe not attractive, but more attractive. So I wanted to give you that. I want to go through a PowerPoint presentation. Is Laura on with us now?
Yes.
Okay. Laura Easton has joined us, the president and CEO of our local hospital. And just for the public to know, the amount of communication that has gone on over a period of time, and I would say back to really a conversation that I was a part of that Laura was leading back in early March, before I ever heard really of COVID. And she was the first person who ever used the phrase in my presence of flattening the curve. And I heard her say it on a Friday, and by Monday, I think everybody knew exactly what it meant. You know, we've been in contact about what our plans were, what we're trying to do, what steps we need to take, what protocols we need to follow, what we need to have in place in terms of supplies, what our responses need to be, just anything in terms of operation. And I've never been afraid to ask a question, even if I thought it was a silly question or something that I ought to know, because I felt like I need to know what the answers are. And we've done an awful lot of that. We had a call yesterday with Anna Martin from the health department. And the folks from the health department, our school nurses, have been tremendously helpful in the work that we're doing. And Laura certainly is too. And I asked Laura just to be here today to answer any questions that you all may have. And I just want to go through my presentation. And Laura has heard a lot of this because she's been involved in a lot of the work that's been going on. But as we go through this, if you have questions, she certainly can give you some insight. I think the biggest area that she's going to help with us immediately is going to be working on the protocol that's followed with some of the processes that we have to follow. So I want to go through this. Don't spend a great deal of time with it, but I want to try to answer some questions and just share with you all as a board and the members of the public of what we've been dealing with. We've done quite a bit of work in terms of gathering information, seeking guidance, taking directives, whatever it is that's passed down, that whether it's coming from Washington, D.C., or if it's coming from Raleigh, or if it's coming from some local source in terms of things that we need to do. We've had governor's guidance and guidance from the governor's office. The governor's education liaison has been involved with superintendents throughout the last 5 months in conference calls and in meetings. We haven't had any face-to-face meetings with anybody, but the conference calls that we've had, he's been a part of that, Mr. Coltrane. He's answered individual questions that I've had on things that included stuff like what can we do on a graduation situation, or even more detail. Here's what we're planning to do at a particular graduation. Are we allowed to do that? And then going back and answering questions to interpretations of the governor's executive order. So we've had individuals that have done tremendous work, but you all know that the governor in mid-July came back and said that LEAs may open with option B. We were told from the get-go, whatever the option was, we could go more restrictive, but we couldn't go less restrictive, and that's where we happen to be. He also said that face masks had to be worn by everyone in the school building. I can take mine off right now because you're allowed to have it off if you're doing public speaking, and I'm also not within 6 feet of anybody here. So we're honoring that, and we're doing that not just at the Ed Center, but certainly in our buildings and our schools when students come back. We've had a great deal of guidance from the Department of Health and Human Services. Primarily for them, it's in the area of protocol of what we follow. Now, I will tell you, just like everything else that we've dealt with over the last 5 months, things change, and the guidance changes, and the protocol changes. And things that are coming down from Washington, D.C., and in particular, the CDC, has changed some of the guidance. More recently, they changed guidance on what universal screenings look like in schools. And we've had to meet with, and my question to DHHS was, is that going to change what your recommended universal screening is? And they pushed that back to LEAs to work with their local health providers and the health department and the directors. And we've done those things. So we've worked on that. And then DPI's done collective work. They've done collective efforts between DHHS and the governor's office, the State Board of Education. There's been a lot of work that's gone on. And I know you don't see it because you're not in those meetings, but they're happening on a weekly basis. And we're getting updates, and we're getting sometimes changes to what we heard the week before, but we're trying to plan and do the very best planning with as much information as we possibly can. Will you move that forward, Kathy? We also have a variety of publications that come from some of the same sources that I'm talking about here. The Department of Public Instruction put out a document. The date that it was released, I think it was either almost or over 120 pages long, that had details of things that we went through. It was called Lighting Our Way Forward. The day that was released, they said it probably is out of date 24 hours later because things in that document change. And they put a lot of links. They put a lot of electronic information that could be updated when that information, the primary sources were updated. We received a public school health toolkit for K through 12 from the Department of Health and Human Services, a reference guide of suspected, presumptive, and confirmed cases of COVID in K-12 settings. This also from the Department of Health and Human Services. And these are the guides that we're using to try to define what our protocols and procedures are going to be in our school setting. Can we come up with a solution and a detailed description of every single detail? We can't. You know, I had a staff member who told me a couple of weeks ago that we haven't answered every question. I don't know that we'll ever answer every question. We're trying to do that. And we know the answer a lot more right now to questions than we did back in June. But I'll tell you that I'm going to deal with questions next week that I don't even know yet that are going to come up. And I try to deal with that. So we say we have a plan, and we do have a plan, and we're working through that plan, and we're vetting that plan with our professionals. And if it's a medical plan, then we're talking about what that looks like from our medical community. If it's a transportation plan, we want feedback from our transportation experts. And I can't say thank you enough to the folks in our school system, the team members that we have that are employees of ours, but also our community partners who have done tremendous work. And two of those are what I have listed under that bullet for medical officials. And it's the Caldwell County Health Department, not just Anna, but everyone who's worked with us there, Dino, Paige, the folks that I've reached out to that have pulled information together to answer questions for me and to help me understand things. Folks at UNC Caldwell, and there are many, many others across the county who have been helpful. A lot of local officials. We've had the statewide and regional meetings. I've told you these are happening on a weekly basis. And the leaning that we do on other LEAs, not to copy anybody, but to find out what's going on in their neck of the woods and understanding that what Mark's dealing with as a superintendent in Wilkes County may or may not be the same thing that we're dealing with here. You know, he had a situation with one of his poultry factories or plants or processing facilities a few 6 weeks ago or so that made national news. And he doesn't have that problem anymore. So things in his world change just like they do in ours, and we try to be abreast of that. We're looking at data points, the same data points that you were looking at, the same data points that the people in just folks in the public are looking at, the same data points that are presented by the folks from DHHS and the governor's office, the number of people tested, the positive test numbers, the percent of people who tested that were positive, what the hospitalization numbers look like, what the death numbers look like. We're looking at a state level, regional, and local level. We look at age breakdowns and distributions, and I'm gonna have a little bit of that in here in a few minutes, and also zip code distributions, which give you some information. And then we also look at trends. And I think trends are important because you want to look at patterns, and you don't want to get too excited, high or low, about what happens, but you're looking at trends. And right now, I feel like the immediate information that we have, I'm hopeful that we're moving into a positive trend. But I really can't call it a trend until we have a little bit more time to have that. I will say that looking at the data and the school boards that we have, Caldwell County's position changed 3 positions just in 24 hours in a positive way from yesterday in terms of where we were at. And in some areas, when you look at counties that are identified as areas to have they're looking at for whatever reasons, we showed up as one of those earlier in the week. And I talked to Anna, and part of that has to do with outbreaks. And the outbreaks we're talking about are at residential care facilities and in prisons and places like that. So you want to dig down, a little bit deeper in terms of what the numbers look like, and we'll talk about that. But one of the other questions that I've asked is there a rate or a number or a threshold of what's called the community rate for transmission? And that would be the number of people who are tested and how many of those are positive. What does that percentage look like? And like everything else that I've dealt with in the last 5 months, I get a different answer depending on who I look at. And there's some authorities that say that number needs to be 5% or less. There's some folks that said the number needs to be 10% or less. I've heard from the Trump administration, the guidance that they're given is that we need to look, if we're 8 to 10%, then you're in an area that you need to really pay close attention. And I asked DHHS, and you can see the answer that we got right there. It says that the Department of Health and Human Services has not set a specific positivity rate. And then they go back and they reference the fact that Governor Cooper said that you can open on Plan B, and that was a floor. And that's the response that we're getting on a lot of the questions that we ask. And I know that the fact that the floor is Plan B means that's the limit. You can't go anywhere beyond that unless you're more restricted. And I think the local conditions in the county have to dictate where you are, and that has a lot to do with what we're doing. To give you a little bit of background as board members, to give the public a little bit of background, I wanted Dr. McKellen to come up. The three next slides are slides that go over the survey data. We've talked with you several times over the last month or so as we eyeballed a plan to eventually try to get back in school. And part of that was the survey data of parents and teachers. And when we last talked to you, I think the deadline had come and gone, but we hadn't had an opportunity yet to pull things together. Or maybe the deadline was coming up on the Friday when we met on Monday. I can't remember. But we have that actual number now. And I think this speaks volumes about what the wishes and the intents are of our parents and our faculty members. So Dr. McKellen, if you'll speak on that briefly, then I'll come back up after the next 3 slides.
So when you look at this data, and this was done, I think we closed it that first week in July. We're surveying parents on Plan A, so that was returning everybody coming back to school. Plan B was the 50% or fewer coming back to school. And so under Plan A, we had about 75% said yes, we would be sending our students back, and 25% who said no, and then a portion of that 25% said yes, we would, we don't want to send our students back to school, but we want to participate in a remote opportunity. Under Plan B, we actually had 72% that wanted to return, with 28% saying they didn't want to return, but of that, 14% were willing to participate in a remote opportunity. So that was from the parents and the students. On the next slide, this was when we surveyed our staff. We wanted to know, so if we're returning under Plan A, what percent of you are going to return, feel comfortable returning to work? And we had almost 84%. Under Plan B, it was 92%, and under Plan C, it was 85%. And so, and you may wonder about the Plan C, but I think it's when you start talking about teaching remotely, and you may not feel like you have the necessary skills to teach remotely, I think that is a fear, and has been a fear for some of our teachers. Their other thing was if I can't feel like I can return into the building in front of a classroom full of students, but I am willing to teach remotely. So that got another majority of our teachers. And so when you got down to I'm not willing to come into work and I'm not willing to teach remotely, then it was a very small percentage under all plans, really, Plan A, Plan B, and Plan C. And then when we look at the next slide, so we've this is current as of this morning at 6 o'clock. When we look at the percentage of our students that have signed up for Caldwell Connect compared to those that we expect to see in our hybrid schedule, which means they're coming to school 2 days a week and they're participating remotely 3 days a week, versus our Caldwell Connect opportunity, which is our fully remote learning opportunity. So we're up to 11,000 students. And it's a very similar split to what the survey results said. 76% are coming in under the hybrid model 2 days a week, and then 24% right now are participating in Caldwell Connect. That's a brief overview.
A lot of work. I cannot tell you the number of hours, and it goes well beyond what working hours are that individuals have spent working on this. And we'll continue to do that as we refine the efforts that are going on. And I have no doubt that a month in, it'll look a little different than it does on the very first time that we do it, because we're going to learn as we go through. There's some responsibilities that I think it's important right now that we publicly talk about. And I think from a school system standpoint, some of the responsibilities for us are the protocols that we follow. And protocols may be the procedures that we have in place, what we do with respect to screening measures for children. As Laura Easton and I have talked about, what do we do if there's a positive case, in the involvement with our health department and the others that are involved, and the steps that are taken, the safety measures that are in place. I'm going to talk in more detail with Dr. Church about this. And then level of training for our staff members, training for our students to make sure that they understand what the expectations are and that we're doing things differently. We didn't start last school year with face masks and social distancing and limited numbers of students in classes. And this is going to be new. I mean, it was new to me when I got started having to get to a point where I felt comfortable with the face mask on. It'll be that way for our students and for our teachers, but we have to maintain the vigilance that we have to ensure the integrity in what we're working on. The health department has some responsibilities. They're working with us and along with our school nurses. Right now, we only have 11 school nurses to cover 25 campuses. We have a dire need for school nurses. So we'll talk a little bit about some options that we have to look at least a temporary fix for that, or some assistance that we can provide. But they're also helping with protocols, defining protocols, to look at our protocols and determine if there's anything that we need to do differently. And again, I'm going to say on the protocols, on the first day of school, we're going to have some things written down that are protocols that we're going to put in place, and then we're going to come back and debrief and say that either didn't work the way that we thought it should, or we can do it better. And our protocol on day 2 or 3 may look different than day 1. And I just ask the public to work with us and allow us to do it so that we work effectively and efficiently in everything that we do. The hands-on assistance that they provide and the guidance from the health department is very valuable. But maybe most important, and this is not passing the buck, but I feel like we're in a day and age where everything seems to fall on the school system. The school system will take care of this, and the school system will take care of that. And we do what we can do. And there's a lot that we do, I think, differently than what may have been done 30 years ago. But there's still a role that the parents have to play, parents and guardians. And one of those is that they need to continually monitor students. And I'm not talking down to anybody, and I'm not trying to insult anybody from a parent's perspective, but these are responsibilities that have to be accepted. Part of what we're talking about doing are putting things in place that we have some control over, with the understanding that the partners that are working with us are doing what they need to be doing. The most important thing is if a child is sick, they should not be sent to school. And there are You know, if a child is throwing up, if they have diarrhea, or if they're running a fever, they should not be at school. There are a set of questions that we're going to ask parents, and these are going to go out and they're going to see them over and over again. But if a parent can answer yes to any of these questions, the child needs to stay at home, and they probably need to seek an appointment with a medical provider. And you all have heard these. Number one, have you had close contact within 6 feet for at least 15 minutes in the last 14 days with someone diagnosed with COVID-19? If the answer to that is yes, your child should not come to school. Number two, has any health department or healthcare provider been in contact with you and advised you to quarantine? If the answer is yes, the child should not come to school. Number three, have you had any of the following symptoms within the last 24 hours? Fever, chills, shortness of breath, difficulty breathing, a new cough, or a new loss of taste or smell? Again, if the answer is yes to that, child should not come to school. Those are things that should be taken care of before the child gets ready to be driven to school, or before the child gets ready to get on the school bus. And what we're going to do is take temperatures once children get to school. Every child that comes in our building will have a temperature taken. But a temperature is just one indicator. And a child may have a temperature, that doesn't mean they have COVID. And a child may not have a temperature, and that doesn't mean that they don't have COVID. It's one indicator. The most important part would be your child's behavior. And a parent or a guardian knows when their child doesn't feel well. And if the child tells us that they've got a stomach ache at school, there's going to be a protocol that we follow. Not every stomach ache is going to be COVID, but we've got to look at it. We've got to make sure that we're following the procedures that we have in place. So we're going to have these questions out. We're going to make sure that parents know what they are. And every adult that comes into our building is going to have to answer these questions. And every adult that comes in our building is also going to have a temperature taken. So we feel like we need to have that as a safeguard. But also
to wearing masks also, correct?
And that's very good. They also will be required to wear masks, yes. The only time masks will not be required will be when a person is eating, or if they're outside doing a physical activity. And we've had some discussion, and I don't have anything formal to say right now about what a mask break would look like, but I know I would have a hard time during the course of a school day of wearing the mask without taking it off, but they will not be permitted to take a mask off if they've got to be able to maintain that social distance. So we're still working on that particular protocol. And we need your help with that. You know, there's individual responsibility. And I know the first thing that someone's going to say to me is, how do you expect a 5-year-old to assume individual responsibility? Part of that is practice. Part of that is role models that are following through with what we're asking them to do. And it is going to be challenging. It's going to be challenging for a 15-year-old to do it on a regular basis. It's challenging for a 45-year-old to do it on a regular basis. It's just a different way of having to interact and do what we do on a daily basis. And they're what you've heard as the 3 W's. We have to wear face masks. We have to wait 6 feet apart, which is also maintaining social distance. And we have to wash hands regularly. And we also have hand sanitizing stations that Dr. Church is going to talk about in just a few minutes. You know, part of our protocol is, as long as folks are wearing their face masks and as long as they maintain social distancing, they haven't met the definition of exposure when we're talking about other children or other adults. So as long as we're following those guidelines, the levels of protection for us are where we feel like they need to be. Our safety measures, I want Dr. Church just to help me out with some of these. He's done a lot of work starting back. Again, I keep going back to the month of March because we got thrown into a tailspin. You know, a lot of us were hopeful that we'd be back in school before the school year ended. And as we trotted along and we went through from one week to another, it became more evident that this is going to be more long and it was going to be drawn out longer than we thought that it might be. So Dr. Church began to amass some supplies. We had some supplies that were provided to us by the state and by the federal government. And there are a lot of pieces there that the public will never see, but I want the public to hear us say we are engaged in their use on a regular basis. And these are cleaning materials and cleaning supplies and cleaning regimen and the expectation that we have for the things that are done. So Dr. Church, if you want to come up, talk about that and add to anything that I've said, if you don't mind, on this part.
Thank you. First and foremost, I'd like to say publicly, thank you to Mark Wheeler with our maintenance department, because he has been invaluable in getting the supplies and materials that we have. I know he's lost sleep trying to find supplies because hand sanitizer. we're not the only school system. We're not the only entity in the state or in the nation that's wanting that. Everybody's wanting that. Face masks, same thing. And so he has been invaluable in getting some of these materials for us. Screenings, we are taking temperatures for all anybody that comes into our buildings. One of the issues that we had early on is how are we going to do that at a South Caldwell? How are we going to do that at a Hudson Middle School, at a William Lenore with high volume students? If you have just a handheld thermometers, by the time you get your temperatures taken, it's time for lunch or time to go home. So we have purchased some thermal cameras that mount on the ceiling that has a device that when you walk in, MDI I think uses something similar to that. And it's real time when we come in 6 feet apart, maintaining our social distance. We have those devices and we'll be able to monitor that when it comes in. Face masks. Face masks are hard to find. Well, not if you want to pay the premium that everybody is wanting to sell them for right now. But as a school system, we're having to maintain safety. But at the same time, we need to maintain our budget as well. Dino is unbelievable at what he does. Dino DiBernardi. He does a Monday, Wednesday, Friday call, safety call to various organizations, to municipalities and fire departments, and he's invited the school system to be a part of that. And through that call, he gave us an avenue to request face masks from the federal government. And so we were able to do that, and we were able to, without cost, we were able to receive, I think it was 52,000 face masks. And that's the ones that are in the 5-pack. Since then, we also have received face masks from the state. So we appreciate those opportunities. Social distancing, as you came in the front door, you saw stickers on the floor showing, decals on the floor showing social distancing reminders. We have those stickers, those decals in all of our schools. We purchased, I think, 8,000 stickers or decals and divided them out to our schools. And you'll see those in our hallways to remind our students to maintain social distancing as they're going through our schools this year. Hand sanitizer stations. Again, sanitizer right now is liquid gold. It's hard to find. And Mark was able to talk back in August. Back in March, one of the things that Mark was doing early on is trying to predict what we need whenever we come back. So he's trying to get ahead of the game because he's trying to order this, try to be the first one to order it, not the last one to order it. So we were able to get, I think it was 100 hand sanitizer stations, and they were promised to us. They have come in, they have been delivered to our schools, and they're there at the schools now. Every door that we have, we'll have one of those hand sanitizer stations. I think there's one in here. So those will be at all of our schools. I think each school was allotted the initial allotment of 4, and then based on the size of the school, the allotments went up from there. Water bottle fill stations, again, if you notice when you go through schools, we have to close off water fountains. And we looked at devices to close off the water spigots, the water fountains. And it was it's astronomical as a price. You got 6 of them for close to $50. And when you have the water fountain, the number of water fountains that we have, you can't do that. So our maintenance department came up with a device to close off our water fountains. We did order water bottle fill stations. We ordered 50, and our school, again, everybody is ordering those, and so we're hoping that they'll come in. When Dr. Phipps started his presentation, I got a text. We have 34 of the 50 that came in today, so we'll be installing those today. Signage, it goes back to the decals that we talked about. No large gatherings. That goes back to what we've been following through the governor's order. Student supplies, we're looking at, I know we mentioned that at the board meeting, looking at boxes. We could use some help from the community to provide boxes, help with boxes. Our schools are buying boxes to individualize student school supplies where we're not sharing pencils and we're not sharing supplies, trying to keep keep all the student supplies sanitary. Lunch will be different than what it's ever been before. We'll be using takeout trays. And then we'll have to learn a process from takeout trays, because if you've ever been to a restaurant and got a takeout tray and you open it up, if you just throw all those in one classroom could fill this area up here very quickly. So we'll go through the process of how to stack those correctly where we can dispose of them appropriately. There's a lot of things that you don't think of when we're trying to work through the processes of what school's going to look like. The limitation of bus riders. Currently, we can have one rider per seat, and our transportation department has worked tirelessly trying to develop bus routes. As Dr. Phipps has said numerous times, the route on Monday is probably not going to look the same on Tuesday, nor is it going to look the same on Thursday as well. So I applaud our transportation department, Kevin and his staff, for handling that. Cleaning, we will be cleaning regularly. Pulled together a team of principals, administrators, assistant principals, and custodial staff, and to talk about cleaning and talk about what cleaning looks like. And we realize with all the expectations that our custodial staff have, there's no way that they can do all the cleaning that needs to take place just by themselves. So it's going to take a joint effort for that to happen. We've put protocols in place. We've put product out to sanitize classrooms, and the expectation is the instructional leader in the classroom, if it's when the students leave for the day, they would sanitize the area before they leave to go home. Principals will be going over that process with their staff whenever they have their first opening faculty meetings. One product has a 1-minute kill time. Another product has a 5-minute kill time of bacteria or germs or viruses. And then a third product has a 10-minute kill time. So we are looking at all those products. We have all those products. One thing that you will not see on our back to school list that you normally see, a lot of times back to school lists include Clorox wipes. And the school system is not asking for Clorox wipes from the community. If you saw on the news this week, so can't find them. And so we're not going to ask to donate Clorox wipes. We have the product to do the same thing that Clorox wipes does or do. And we ask if a family can find Clorox wipes, use those at home, because the school district has the supplies to do that. We have the cleaning materials. We're going to encourage outdoor activity. Anytime we can get outside and social distance and enjoy the sunshine, we're going to encourage that with our classrooms. Goes back to soap and water. We have hand sanitizer. Every table has multiple hand sanitizer bottles on it in the room today. We have multiple bottles of hand sanitizers throughout our district. But bottom line is soap and water is everything we hear. Soap and water is the best protection for sanitation and keeping clean. So we're going to highlight that as well and to make that a practice, making sure that we keep clean with soap and water. We are seeking more school nurse positions. We worked with Robert Semple yesterday. We're in a meeting with DHHS and meeting with the health department. And I think the hospital might have been on the meeting also. But we currently have 11 school nurse positions, and we're going to look for grants and possibly try to contract more nurse positions to have the nursing staff in our buildings. And we're working as a school staff to reduce number of students in physical spaces in our classrooms. We have to maintain social distancing. So when students come into our building, we will not have full capacity buildings. Capacity will be based on how many students you can get into a classroom 6 feet apart, and instruction will be based on that. Any questions? A very quick overview. Any questions?
Let me just ask in regards to the bus riders, if you have two that are like brother and sister, they could ride the same seat?
Yes, sir. I apologize. I didn't mention that, but if you're in the same family, you can stay in the same seat. Yes, sir.
And let me just mention one other thing too, in regards to the face mask. I know we've gotten some donated to us. And one day, one of my neighbors who's in management at our manufacturing neighbor over here in Ecto,
Yes.
he asked if we could use some face masks. And I said, sure we can. So they have donated, I think it's 8,000.
8,000. Yes, sir. Thank
So
you.
Ecto has donated 8,000 masks to the school system.
And we have multiple individuals throughout the community making masks. I know there's a family that go to our church that's giving out close to 2,000, 2,500 for no cost. So we appreciate everybody that's pitched in for that. Thank you, Mr. Chairman, for bringing that up.
The reduced number of students in spaces is evident if you go in a classroom and what you would normally expect to see with desks. It's just a much more spread out environment with fewer desks there. And we feel like it's important that we do that. There's some numbers and some trends and some data that's produced. And this is going back to the beginning of March, beginning in the date of March. And what I don't have on here is the trend of what the next data set will look like. You'll see a decline from where there's been this is the confirmed number of cases. And I'm hoping that what's going on this week will continue to be a week that will be a positive trend that we would see. The same thing here in terms of the percentage of positive cases. You'll see a downward trend on that when the next line is put in. This is actually up to date as of today. This is going back all the way into the month of March, and these are the total number of cases on a daily basis. And you can see what that trend looks like. The yellow line that rolls through the middle is a 7-day rolling average. And what we've seen over the last few days, again, going back to Monday or so of this week, is a drop off in a number of cases. And then the rolling average number continues to reflect that. Taking a look at where we're at with the number of positive cases by age groups, I had some folks that wanted to know what this looks like. From 0 to 5, the number was 27. 6 to 10, the number was 39. And 11 to 18, the number was 86. And there can be a lot of conclusions, I think, that individuals can draw from that. But the fact is that there's numbers that are represented there, and we want to make sure that we're doing everything within the environments that we have any control over to try to manage and mitigate that as much as we possibly can.
What was that last number? I couldn't see the age group on it.
It's 11 to 18.
Oh, I'm sorry. I was looking on the wrong.
And when you look at that, I think that's important to note. The numbers of years that are reflected in each one of those columns are not equal. There's a different number of years from 0 to 5 than there is from 11 to 18. And also when you think about 11 to 18s, that captures the 16, 17, and 18-year-olds that are very mobile, that have the ability to go places. And a lot of that probably has something to do with the numbers. You can draw whatever conclusions you want. I just wanted to share the numbers and let you see what they look
The
like.
average for the two columns, the last two, basically school-age columns is exactly, I mean, it's pretty close to exact. The 6 through 10 versus 11 through 18, even though that number's different. So if you figure that many more years involved in it, it's about the same number per age.
This is a pie chart that just shows, if you take a look at the currently active COVID cases in Caldwell County, and you take that number and you consider it in relation to the population of Caldwell County, you can see that it makes up less than 1% of the almost, I guess, 82,000 is 81,991, I think is the number that we calculate on. And then if you take a look at the actual positive cases that have happened throughout the duration, and you consider that number in comparison to the overall population of Caldwell County, that you just kind of get an idea of what we're dealing with there. So it looks small, and in many cases, I think it is small. But for the individuals that are impacted, it's not small at all. It literally can be a difference of life or death. And we have members of our community who have had to deal with that in their families. And I certainly don't want to minimize that at all. But I think we need to have in perspective the big picture of what we're dealing with. And we certainly, our hearts go out to those individuals, and we don't want another individual to die. We don't want them to be bedridden. We don't want them to get sick and have to deal with any of the symptoms and things that go along with that. We certainly don't want that. But I wanted to have this opportunity today just to ask you if there are any additional questions. I'm hoping Laura is still on with us. And she was going to be there if there was anything from the hospital standpoint of any of the conversations that we've talked about in planning that we've done, some of the conversations she and I had earlier today about having a team from the hospital come in and work jointly with a team from the school system and also the health department. Because, the medical work is not our work. That's not what we do. We're leaning on individuals who have medical backgrounds to do that work. And that's where those partnerships come in to play, because we want them to be able to do that. So Laura, I want to just ask you if you want to share anything based on the months and months of work that's gone on and the things that you've experienced from the hospital perspective. And as we talk about what we're looking at with a reentry plan, that would be an abbreviated schedule and an AABB, and then given a remote option to the parents and the teachers who have chosen. Just wanted to get some feedback from you if you don't mind sharing. Looks like she may be muted.
Can you hear me?
Yeah, we hear you now.
Okay, I'm sorry. I just want to say thank you for inviting me, and I wanted to compliment you, Dr. Phipps, and your team, and I think you've done a wonderful job at addressing everything that has been recommended in order to minimize the risks of spread of coronavirus when you open. I really appreciate we're here as a healthcare system to uplift and support our community and help you in any way as you go forward, as you know. And I appreciate the partnership with the health department and with you. We have 5 months of experiences being an operational organization through this COVID crisis, and we're happy to offer our experience and expertise as an employer with an employee base and having implemented these solutions. And I think, a couple of things that I think we've all agreed upon already, which I think will be very helpful, is the health department, the hospital, and the schools are going to have a weekly call, collaborative call, just to talk through issues that we're facing. I think a daily huddle is scheduled and planned so that we can say what's before us today and how can we help each other. And in addition, my team is very willing to offer our experience and to get together with a group from the school system and the health department on just, how we handle exposures and quarantines and all of those matters. So I think you have great protocols. I've read through them for managing the inevitable circumstances, a kid with a stomach ache or a kid with a fever, or, all of the things that will happen, or a teacher. And you have great protocols, and I think we're happy to help and work with you in any way we can to make this go as smoothly as possible. The hospital, of course, hospitalizations are up, and the number of people hospitalized with COVID has grown, and each week UNC healthcare system provides an epidemiological prediction of where we're going. And we anticipate hospitalizations to peak in mid to late September. And the size of that peak is the only question. And the size of that peak is impacted by how well we implement these 3 Ws. And so I think it is just incumbent upon the entire community, the school system, all families, all teachers, all of us just have to be very, very disciplined with the mask wearing and hand washing and the distancing. And that will really help us best care for people who end up needing hospitalization. But I'm optimistic that we can do that working together. But it does take a lot of diligence. And so we'll just maybe share some of our strategies on how we've helped with the diligence and develop procedures for that. So anything we can do to help, that's what we're here to do.
Laura, I don't want to put you on the spot, but would diligence be the answer that you would give if I were to ask you to speak to students, parents, or teachers about concerns or fears that they have about coming back to school, what would you say to them?
Well, I refer to there's 3 levels of risk, that we look at as a hospital: high risk, medium risk, and low when you're encountering other people. If both parties are wearing a mask, it's a low risk, even if you are talking with someone who has COVID. If you both have a mask on, your risk of transmission is low. If one of you does not have a mask on, the risk of transmission is medium. If neither of you have a mask on for 15 minutes and are in contact with each other, the risk is high. So it's really pretty simple. We just got the diligence of wearing those masks, and families setting that example and encouraging their children and supporting their children, and teachers doing the same. I think, that will mitigate risk for all of us.
And then when you layer on top of that the other 2 W's, I would have to think that the risk would go down even greater.
Correct. The distancing in particular.
Board have any questions?
So with the age groups that we're going to be dealing with, that we're going to be involved with here, you feel good about the plan that has been presented?
Are you talking to me? I'm sorry.
Yes, I'm sorry.
Yes, I'm sorry. I think Dr. Phipps and his team have implemented every policy that is recommended.
Thank you.
Laura, I just want to thank you publicly. And Anna and I had talked from the health department. Anna had a previous engagement and couldn't be here, but Laura and Anna, I don't think you can find a school district in North Carolina, and I would dare say across the country, that has 2 better professionals that are willing to work with us. And it's not a turf type thing. It's not holding back information. It's what can we do to help you? And they've never spoken to us in a demeaning way, because we certainly don't know their business and we don't pretend to. But Laura, on behalf of everyone who has worked with you and who will down the road, thank you so much for your assistance and your service. And we count you as a very valuable partner to the work we're doing. Thank you so much.
Thank you, Dr. Phipps.
All right, I wanted to have an opportunity for anybody else. I don't know, Bill, I didn't have you or David anywhere in the program. I don't know if there's anything you want to add, and if there's not, that's certainly okay. But I wanted the board to have an opportunity to ask questions, to hear some, I've tried to give you as much information. You all are connected with data and you're monitoring that type of thing. We've got a group of students that are going to be coming back on campus on Monday, our Early College and Applied Sciences Academy. Although I say they're coming back in smaller numbers. I mean, they're coming back in waves, just like we're doing our AABB. It's a little bit different with students that are on a college campus, but there won't be as many on a campus in a location at one time as there would be in a normal setup. And then our rest of our students would follow the week that follows that on August the 17th. And then we have our 25% or so that would be doing the work remotely. But I want to give you an opportunity to ask any questions or to share any thoughts or whatever needs to be done before we move forward, and just make sure that we're all on the same page with the work we're getting ready to embark in. I do not know how to predict what this is going to look like, because we've never been through anything like it before. And when I feel like I've got all my ducks in a row, all of a sudden I look over and one's scooted away and I've got to try to grab it. And while I'm getting it, something else has moved over here. And it's so good to have multiple hands that are working with me, and people that are helping out, and folks that are experts that can do the expert work that I don't have to try to make up on my own.
I feel good with the protocol you get us. And we are a system of choice. And we've given the choice to our students, and we've given a choice to our teachers. So thank you.
And Katrina shared with us the results of the surveys from the staff in July. How did those numbers correspond with what families picked when people could sign up for Connect Caldwell, I guess last week or week before?
Was it about the same 3/4? Is that what we thought when we saw
Actually, I'm wondering, do we have lots more wanting to teach remotely than we need, or where are we?
We actually had to draft people or look to have principals assist in getting teachers to fill some of those spots. So we have worked diligently this week to put together our staff members for Caldwell Connect, and we have a plan in place, and should have that ready to go this afternoon.
I think the numbers that I remember was there was 50 had signed up and we needed 107. So they had to recruit basically 50 teachers to do the connect.
So none of that's changed. We're still good on that part.
We are working hard to finalize that by this afternoon. Yes, ma'am.
So teachers want to be in the classroom.
The number in terms of if you were to use how they signed up or what their intent was or what they requested, there are many who want to be back in the classroom. And we understand that I think everybody wants to be back in the classroom, but the conditions that where we are right now, we respect that. And I think providing the options that we have for those choices allow folks to be able to find a landing spot, at least for the time being, in an area where they have some comfort. But for those that want to be back in school, you know, we wish we could be back 5 days a week, but we can't do that right now. And I have no idea what on the horizon, how long that's going to take. So we've tried to put out options that would give families and students and teachers, staff members, the choice to be able to do what they feel like is right for their situation.
Well, it's not an easy decision. I mean, I don't think nothing has been taken as an easy decision, and it shouldn't be. But as you explained, the hospital, the health department have basically went through what we're trying to do. You can never take away all the risk. You know, it could be the flu, it could be a snow day and you got children driving to and from school. There's always going to be a risk. And I understand this is completely different and none of us have ever experienced it. And I'm not trying to compare those, but all you can do is be the best prepared that you can be and know that you're probably going to have to adapt in some way. And hopefully you realize that, hey, we can sort of lessen things rather than we need to tighten things up. I mean, we're following the guidance that's been given to us. I feel like that's what you've stressed to us in the public with this presentation.
And I want to also say that we'll reserve that opportunity as this goes on. I mean, I have no idea what conditions are going to look like 3 weeks or a month or whatever down the road, but we have to come back and say, you know, this is what the conditions look like right now, and this is the advice that we're getting from the officials that we're listening to, then I'll do that.
I'm sure you are probably going to be stressing to our administrators, and the administrators stressing to the teachers those things that need to be done on a regular basis. The distancing, the washing the hands, and the wearing of the mask. I think it's going to be imperative on each teacher to follow those guidelines as strictly as they possibly can.
There will be a lot of reminding going on with adults and with students. I have no doubt about that. But as adults, we have to lead by example, and we're certainly committed to doing that. Any other questions for me or any of our group who are here?
Well, I'd just like to say, and a big thank you to you, Dr. Phipps, and to all of your staff and the people who have talked today, but also to every educator out there, because my belief in the years I've worked with professional staffs and administrators is that they work as hard as they can to rise to the occasion for their students. And I'm constantly thankful for the effort and the time I have seen out there. In fact, after talking to one of my friends who is in the health field, she talked about the good parenting that's going on for people to be ready, just like we used to practice their children for kindergarten. And we're practicing with our staff. They know they're going to be wearing masks, and it's hard to wear a mask, hard for me. And so to practice a couple hours a day so that they're ready to talk with them and to do what they need to do. So I think this has been an uplifting enlightenment for us to hear today, and I hope it has been comfort to our citizens in Caldwell County that we have such dedicated teachers, administrators, professionals, staff here who are working to make this a safe opening and for continued learning to occur in our county.
And I would like to just echo Mrs. Edwards' comments and say a thank you to you and to your staff. I know that you put countless hours, days into establishing a plan that follows all the guidelines and guidance that you've been given. And a thank you to all of our local partners from the hospital, health department, emergency management, everyone who's been involved in this process. Because the priority is implementing a plan that provides the safest environment for our students to learn in and for our teachers to teach. And certainly I really appreciate all your work.
You know, I can't thank our teachers enough. I can't thank our child nutrition workers, bus drivers, every position that we have. And I think back to, you know, what we threw them into in March with little or no preparation. And I heard a comment that Dr. Griffin and I were talking about earlier this week. You know, we reached out, we made a concerted effort to reach out to the homes of our children on a regular basis. And we felt like sometimes it wasn't about the academic. It wasn't a call about academics. It was a call about, how are you doing? Is there anything that you need? And I don't want us to forget about the adults that we work with, not just the, and I mean the adults that we work with from a parent perspective, but I'm talking about our staff members. And they're going through a lot. And whatever role or whatever mode they happen to be working in the fall, there's a lot of stress and strain that's on them. And we've talked about an employee assistance program that we have. We want to make sure that we're reaching out and meeting the needs of our folks, just to check on them and say, how are you doing? Because we're concerned about how they're doing. If I failed to do that at any point along the way, it's certainly a heartfelt apology, but we certainly have thought about that every single day. We did purchase Chromebooks for our classroom teachers. Those have been given out. I don't know what percentage of those have been distributed, but a lot of those have been. It's a small token, but it's also a part of the job and a tool that they have in the work that they're doing. And we certainly want to try to find every way we can to raise morale, to let folks know that they're cared about. And I think the comment that Mr. Knight made and the choice it was given, you know, extending that opportunity to our faculty and staff members where possible, if they can do their job, and giving them that opportunity, you know, I hope is also supporting them and promoting the work that we have to do. What I look forward to is a day when we don't have to have remote, that we have that as a nice option for individuals who want it. But I think from getting from where we are right now to that point, we've got to be methodical. We've got to be careful. We've got to be careful with steps that we take, and we've got to be very meticulous and direct about our practice. And we've tried to do that. So to the board, I can't thank you enough for listening, for being patient, for understanding that you wanted answers, but we didn't have answers. When we told you we didn't have answers, you didn't demand answers. We could have made something up, but it wouldn't have meant anything. And you allowed us to go through the process and take the time to get the feedback that we needed, so that when we came to you, we were able to articulate a plan and a vision of where we felt like we needed to go and how we would do that. So for that, I'm very grateful. That's all I have, Mr. Chairman.
I'm very appreciative for the fact that kindergarten and first graders are in school 4 days a week. The fabric of our world needs children in school, as we all know, especially elementary children in school. And I continue to worry about second and third graders who aren't strong readers, who haven't developed those skills, and how important this window of opportunity for them to learn at the age that they're at. And I just hope that we'll continue to look at every way possible to increase the opportunity for K2 to be in school 4 days a week, K3 to be in school 4 days a week, and eventually, you know, K12 through 5th year of early college.
Earlier today, we went to a graduation with the early college high school down at Franz Stadium in Hickory, and got back a little after 12. It was a great event down there. And, you know, I went home and been thinking about this a little bit. And I jotted down some thoughts here, if you'll bear with me for just a few minutes here. We certainly want to thank our teachers, staff, students, and parents for all their support throughout this period of time since mid-March. It has been a very challenging time indeed. Educating our students is so very important to this board. We are very student-oriented, and we want the best for every child in Caldwell County. The teachers have had to teach our students, while in many cases having to help their own children with their work. It has indeed been difficult for many parents as well. The Food Services Department has faithfully worked to provide probably close to 900,000 meals since March. An amazing feat. In planning for the new school year, Dr. Phipps and the Education Center staff have worked devising 3 plans at the request of the governor. Dr. Phipps and his cabinet staff have put in countless hours in video meetings with state medical officials, as well as with the governor during his press conferences. They have engaged in dozens of Zoom meetings during this time. Dr. Phipps has been in daily contact with our local health officials, as well as state medical staff, to determine our best path forward. His staff came up with the various plans, and then in mid-July, the governor indicated that Plan B was his suggestion, but leaving open the option of remote learning. Here in Caldwell County, Plan B has been approved with the option, if any student, parent, or teacher wants their child or themselves to be on remote, then that would be permitted. Again, with much work, the superintendent and staff developed Caldwell Connect for the remote learning students and teachers. The board has been very actively involved and well informed with the very best and the most reliable information from our medical community. They are, as you heard Mrs. Easton say, they are in support of our plan. We know that students need to be in school to get the education that they deserve. We are also concerned about nutrition and a number of other issues as well. We all have stated that safety is paramount, and we will, with our medical sources on board, keep up with we need to be going. I have a grandchild, and she's going to be in first grade, and she's going to be going to school. And I'm sure that there's a number of other people that have relatives, grandchildren that will be in school as well. So we're very concerned, and we want the very best for everyone. This decision has been extremely difficult. But Dr. Phipps and his staff, all the medical resources that he's called upon, and the governor's office have provided us substantial reason to move forward. This board has worked very hard on reading emails, articles, going to meetings, and working closely with Dr. Phipps and his staff. Again, the safety and health of everyone is most important to each of us, but we must move forward with the very best information that we can get. So it's a very difficult situation, something that we a year ago didn't think we would ever have to deal with. But here we are, and we are doing the very best we can with the very best information possible. And much is owed to Dr. Phipps and his staff for helping us through this and directing us in this. So that's what I have. Dr. Phipps, do you have another item?
No, sir.
Yes.
Yes,
Dr.
ma'am.
Collins.
There was a list of policies that you have that we received from the School Board Association. There's a time issue with these, so we wanted to get these in front of you as soon as possible. You have those as attachments on board docs if you want to go back and look at those. We would like to bring these up for approval on Monday night at our regular board meeting if we could.
Yes, need a motion to put on public
Yep.
comment.
Do I hear a motion that the items mentioned by Dr. Phipps be placed on public comment so that we can vote on those on Monday night at our formal meeting. Is there a motion?
Mr. Chairman, I'll make a motion to place the comment period.
Is there a second?
I second the motion.
Any comments, questions? All those in favor say aye. Aye. Any opposed? And the motion passes. Anything else? Thank you, board. Appreciate you. Y'all have a good rest of the day, staff that are here. And we're gonna work together and we're gonna keep moving forward. Thank you very much. Have a good day. Yeah.
I make
Any opposed? We are adjourned. Thank you.